I am Dr. Professor P.C. Manoria, Executive President, 4th World Congress on CKM, Hotel Leela, Mumbai, 18th and 19th April. And I am at the Right Doctor's studio. I'm with Dr. Mohan, who's a globally renowned diabetologist. Dr. Mohan, we have a panoply of new anti-diabetic medication. Rather, we have a drug revolution in diabetes, SGLT2 inhibitors, GLP-1 agonist, and many other anti-obesity medications also. All these drugs, no doubt, produce good glycemic control, good weight gain, they protect heart, liver, kidney and so on, but they do not decrease the number of diabetic patients. So what should be done to decrease the number of diabetic patients? Because every year, every 2 years, 4 years, the statistics keep on mounting and we see colossal figures of prediction of diabetes, India and globally also. No country is having a plateau of the incidence and prevalence of diabetes. So what should be done for it?
Dr. Manoria, it's a very good question, and very often people ask me this. So much of research you're doing, but diabetes is going up in India. I think diabetes going up in India is in one way a reflection of the country's progress. Because at the time of independence, our life expectancy was 35 years. Today it is 72 years. We know that age is a non-modifiable risk factor. So as long as now, if it becomes 80, 85 years, you're going to get more and more diabetes. Number one, because due to age they will get diabetes. Number two, they're living longer, so you will count as the new ones come, the old ones are still living. If they have died, then you won't count them. So I don't think the number going up is going to be a thing that we should focus on. And then the other thing is that obesity is going up. People are getting richer. They are buying transport which is motorized. So they are going to go by scooter or car, or instead of walking and going by bus. Ultra processed foods are going in, and then obesity is going up, stress is going up. All these are going to produce diabetes. I always tell people, let us not worry about the number of people with diabetes. Like everything else, you have little diabetes also, don't worry. What we should be worried about is preventing the complications of diabetes. We don't want blindness, we don't want heart attacks, we don't want amputation of limbs, we don't want severe neuropathy leading to impotence, these kind of heart attacks and strokes. If we are able to prevent that and say that we will not have any kidney failure due to diabetes, heart attacks in spite of diabetes will be same like as if we don't have diabetes. Blindness due to diabetes has gone. Amputation due to diabetes has gone. If you are able to get that, we will be successful. That I think is achievable. It is not a rhetoric, it is not something philosophy we are talking. ABC, you control your A1C, control your blood pressure, control your cholesterol. If you do these three, almost all the complications of diabetes can be prevented. If you just control A, HbA1c, eye, kidney and nerves can still be prevented by just A. So we should focus our attention on getting A1C under control, blood pressure under control and lipids under control. These newer medicines that you mentioned help, no doubt. We could not reduce obesity earlier, now we have got drugs to reduce obesity. But to expect that obesity will go down because of that is too much to expect. For example, in some of the states of India which are not that well developed today, obesity is still very less common. There is a lot of malnutrition even now, undernutrition. Now 5 years from now, those states will also become rich. So the obesity is going to go up. So we can't say, oh, in spite of this drug, why it went up. It is a better nutrition for them. Childhood nutrition is better. Mother's nutrition is better. So I don't think we should be worried too much. We should be worried that none of these produce side effects of the disease. If you have obesity, obesity should not lead to all kinds of other complications. That would be my answer.
See, can you have a full life despite diabetes, and what is your personal experience?
We can. Because earlier, see, in my father's time, I have been in this field now for 50 years. In my father's time, a person with diabetes reaching the age of 60 was very difficult, because they die. By the time they have diabetes, hypertension, we had very little drugs at that time, diagnosis was late. So somebody reaching 60 years, Shashtriptapurti was an uncommon event. Then we started seeing people reaching 70, 80, 90. Now I have a series of patients who finish 100 years of life. They got it at 95 and then they crossed 100. They got when they're 40 years old. They finished 60 years of diabetes and they're still 100 years and they're doing well. In fact, many of my patients with diabetes who are well controlled are doing better than non-diabetic people. Why? Because a non-diabetic patient doesn't go for checkup. It is I am okay, I am all right. Here, every 3 months, they're going for checkup. They're checking their cholesterol, they're checking their obesity, they're checking blood pressure, they're checking hemogram, they're checking for PSA, finding out early prostate cancer. Every year, among the patients who come to us for checkup, they are only coming for diabetic checkup. We pick up liver cancer, we pick up kidney cancer, we pick up prostate cancer early, very early. And then we are able to treat them early, and then they are cured. If they are not come for diabetic checkup, the cancer would have advanced further. So I think if you have regular checkup and have regular lifestyle, people can live up to 80, 90 years without much of complication.
See, the misconception still prevails. If you don't have symptoms, you are okay.
Yeah.
That is the biggest misconception,
That's
which should be eliminated.
Silent killer.
See, again, if you look at MASLD, it is rampant in diabetic patients, obese patients. So, what can we do to minimize it? It predisposes to diabetes, it makes insulin less sensitive.
Yeah. See, we are fond of compartmentalizing diseases and saying MASLD is gastroenterologist, hepatologist, glucose is diabetologist, endocrinologist, some other hypertension, something is cardiologist. We keep dividing. We forget that the body is one. And the insulin resistance and the problems that we have due to obesity, they affect all systems, including the brain. You mentioned insulin resistance in the brain. So dementias can also occur. If we want primary prevention or primordial prevention, we should start very early. Right from childhood, children being very healthy, like they do in China, compulsory swimming, compulsory gym in every school. Child has no reason not to go. Here what happens in our school, they are all worried about academics only. So if they have a PT class, they'll bunk that and they send for extra tuition, extra coaching, all that they will do. Health is very important. We are giving too much NEET exam, this exam, JEE exam. We are only concentrating on that. We are not looking at the health of the individual. So we are producing academic monsters. Oh, they all study. We have to get 720 in NEET. That is our only thing. They are forgetting that your mental health, your physical health, what's the point in getting that? We are going to get heart attack and die after 40 years. So there is no point. So therefore, I think from childhood itself, we should focus on the family, on the child, compulsory in schools, colleges, workplaces. See, what we do as Indians, we work too hard. On Sunday also we are working. Every day we are working. Look at the white man. Friday afternoon finished. You cannot get him on phone also. So Saturday, Sunday is completely off. That gives them, they then take part in hobby. They'll go skiing, they'll go mountain climbing, they'll do something. So they're very fit. So they don't get. Even on Sunday night we'll be sitting and working. So we get stressed out too much and then we get young heart attacks and so on coming. I think our lifestyle we have to change. Once we do that and have a holistic, introduce yoga, introduce pranayama, these are all things which our parents did and grandparents did. If we introduce all that from schools and have a healthy lifestyle, of course academics is important, but I think we should give equal importance to a wholesale development. Our people, they are able to mug so much and get the marks. Ask them to stand and speak one sentence, they cannot speak. They are not trained in communication. They are not trained in empathy. You know, in the MRCP examination, they bring an actor and that actor says, okay, now this man, his mother has just died or his wife has just died or about to die. You go and talk to them. So they are taught, oh, I'm so sorry to break the news, you know, this is like that. If they don't do that, they'll be failed in the exam. They are not going to say first sound is loud or first sound is this thing or murmur of this type. They don't give importance to that. They give importance, how do you deal with the human being? We are not taught that at all. In our medical college, nobody is taught empathy, nobody is taught ethics, nobody is taught fundamental things which are important. I think we should change our focus into a more holistic education, a more holistic approach to life. If we are able to do that, I think we will be a healthier nation and a happier nation. See, there are Scandinavia, every time Finland is getting happiest nation. We are not getting that, no? Because pressure, people are putting too much of pressure on unnecessary things.
See, we are promoting the concept of cardiometabolic physicians in this concept. How do you like this concept?
It's a beautiful concept because I think otherwise we won't be together. You know, you're a cardiologist, you'll be attending cardiology conference, I'll be attending diabetology conference, we will not even meet. I think this idea of cardio, metabolic, kidney and liver. These four are coming together. And some people say, oh, because GLP came and helping all, you have evolved a new speciality. Sometimes from the drug only we learn. So it's not nothing wrong in that. When the drug comes, we're working on why this is a drug working on so many things. That becomes a new science. So I think coming together, it becomes more holistic when you're looking at not just glucose reduction. I'll give sulfonylurea, reduce the sugar. I'll give insulin, I'll reduce the sugar. What if it increases the weight? What if it produces hypoglycemia? So we must have a more holistic approach. That is where I think the cardio, renal, liver, metabolic as a specialty itself. In fact, the Diabetologist, there was a journal, EASD. Now they are bringing a journal called Metabologia. And they asked me to write the first article in that. Define what it is. What is the specialty? What will you treat as in that new specialty? What new training is needed? So I brought in all these aspects. About obesity you should know, lifestyle you should know, about these drugs you should know, about the brain you should know, liver you should know. All this a doctor should know. Only then you can make it a holistic approach.
Thank you very much,
Thank
Dr.
you.
Mohan, for your excellent takeaways. I am sure they will keep an everlasting imprint on the minds of the audience.